of the muscles. So we went also with this laser to try and did more trials before we enter a formal study. And then we went also, because I was working in Dubai, I took the laser to the university hospital for the chronic food diabetic patient, you know, and who represents really a problem. This represents really a problem in the hospital because, as I told you, they are coming every other day for dressing, and they are sucking the economy of the hospital, and they cannot get better. So we were doing trials, and we put up rapidly there in the study to try to see, to control how it was, because we needed to prove objectively that the patient was doing better. And what we did, we implemented with this image analysis the dimension of the perimeter of the wound. As it is marked here, we determine that these areas corresponding to this, we determined that this was granulation tissue growing after the treatments. And then more and more granulation treatment was appearing after treatment that we did on these ulcers, not only where the ulcer is located, but also in the surrounding tissue, which is the method we use. You see, by doing that, we noticed that this was progressively decreasing in size until we had our patient in this condition that it was suitable for grafting. Okay? It is not that we were intending to close this wound chronically, but moreover to get rid of the patient by passing to the surgical department. Okay? So, you could see different process of vascular ulcers in this case, that with the Erbium Jack laser and the Smale technology in 5 sessions, you get to the skin condition in a much better way in comparison to the previous status. And these sessions were conducted, attention, once a week. So imagine with only 5 weeks time, you change completely the condition of the skin. This refined tissue here, you know, with very poor epidermis, with non-existence of epidermis, with almost entering already in the hair follicles, you see, you notice that after the treatment, we were refreshing the upper part of the tissue, and then came back again with the keratin and a nice closure of the epidermis and formation of new collagen. This is the way we were conducting treatments on chronic ulcers. This is a patient who was burned on his foot when he was a child, and he had this condition, attention, for 45 years. His condition is that he couldn't walk. So we did the treatment on that. In 7 sessions, we were managed to get this situation. Not only the histologists proved that the tissue was completely damaged, very weak, no condition correctly, and then afterwards, you know, very rich epidermis, multicellular, and very thick one. So more and more patients suffering from these ulcers were treated in order to get every other week. With 3 sessions, we were able to close this chronic ulcer on the bunion here of this patient. As you can see, this is the Erbium Jack laser, and attention, this is the SMA technology, which is attached. This is taken away and cleaned every time after the treatment, and when ready for treatment, the only thing you have to do is to attach that, and then you go for the treatment. So at that very moment, we were in some way happy that we had another device with some other way of giving results. So we decided to go for a formal study. Formal study in which we included, attention, 23 patients, and the number of treatment as listed here. 8 treatment was the limit that we put, because we noticed already that by already 5-6 sessions we could move the status of patients. So we decided to put a maximum of 8 sessions, because in a study you cannot keep on going forever with treatment. So treatment were given all 4 treatments in 6 of patients that were given 4 treatment, just to compare which was the best range of treatments to be given to patients. The follow-up was for 6 months, and the total of treatment sessions 104. This is, for example, one of the lesions treated, you know, with fistulization of the ulcer. This is what we were noticing progressively, you know, the status of the wound. At this very moment, it's no longer a problem. You can graft it easily, but you cannot keep on going with sessions. There is another another photography on another patient we treat with good recovering of the condition. In this case, the ulcer was closed. But interesting enough is what microphotography, when looking at this tissue here, we noticed that after the laser, there was an enriched increase in vascularization with formation of granulation tissue, and then from the edges of the lesion, they were advancing down like pieces of tissue to create like a mosaic to close the area of tissue. So, and what is the reason for that? It seems, in our opinion, because we have to elaborate a hypothesis of why this laser is treating ulcers and doing so well, is because depending of the phase in which the process of wound healing is, you see, then we have different cells acting. This from the 0 day to the 3rd day, they are the monocytes and the leukocytes and macrophages that come together with the mast cells in order to clean and activate the circulation. You see, in the 2nd stage, which corresponds to proliferation, then that goes from the 3rd day approximately to 1 month. Then you get the fibroblasts and the endothelial growing on the cells in order to activate the circulation. And then on the 3rd phase of repair of tissue, then you get the myofibroblasts and remodeling phase of the whole wound with closure of tissue finally by the fibrocytes. We do believe that at this stage, because these 3 days were already passed when we received this chronic ulcer, we do believe that ideally this action done here, because of waking up cells, but this action of doing these resonance effects with bombarding with this wave, this constant emission wave which are produced inside the tissue, we were waking up these cells